has 4 university degrees, bachelor's, a master's, and a bachelor's degree from the one and only Ohio State University. And having had enough of that, he then moved to North Carolina State University, where he completed his PhD work in topics related to fish health. At that point, we were able to recruit him to come here. He's been here for 4 or 5 years as an assistant professor in the Department of Pathobiology, and he is the director of the Fish Health Lab, which some of you saw yesterday. So, Dr. Steve was with.
What I'd like to do this morning is kind of give a whirlwind tour of what we do both antemortem and postmortem for diagnostics. However, before I jump into that, what I'd like to do is just briefly cover an area that is often, or I should say generally, overlooked by most practitioners, most people in the field of diagnostic work with fish. When you're dealing with fish, one of the most important criteria that you've got to evaluate, even before looking at the fish, is water quality. There are a number of different parameters that are affecting fish: pathogen load, trauma, nutrition, a lot of different possibilities. But one area that is generally overlooked is the water quality parameters. Why is that important? You've got an animal that is defecating, that is excreting, and is swimming, living, reproducing, and breathing in that same water. And so it has to be taken in consideration any time that you're doing any type of diagnostics on fish. Again, we've got fish that are excreting, we've got uneaten food that are adding to the ammonia levels of the water, we've got dead plants and animals, detritus in the system that's adding also to ammonia in the system. You have to know the nitrification cycle in order to understand what is going on in an aquatic environment. This ammonia is toxic. Not as toxic as other agents in the water, but chronically and acutely toxic to fish. As this is building up in the environment, then you get certain bacteria, in this case Nitrosomonas, which breaks down the ammonia to a nitrite. Nitrite is even more toxic to aquatic animals. To get that out of the system, we have another bacteria, the Nitrobacter, that breaks the nitrites down into nitrates. So usually, you have to have an evaluation of those water quality parameters before you can actually really take the first step in doing diagnostics. And it's surprising how many people out there have wonderful, wonderful aquarium systems and they have no idea what water quality parameters are. And so you've got to find out what those are first. There are a lot of aquaculturists out there, or people that call themselves aquaculturists, that don't even have a water quality test kit on site. And that's criminal, basically. If we talk about the new aquarium syndrome, we're talking about people that have small aquariums, they're setting them up, they go to the pet store, they buy an aquarium, they buy gravel, they buy filters, pumps and everything, they buy fish the same day. They don't have an active biological filtration system in that aquarium. What also has to be understood by anybody doing diagnostics is the small home aquarium is no different than an intensive production aquaculture system, or for that matter, even a pond system. These same processes are going on. The fish are excreting ammonia. Those ammonia have to be broken down into less toxic particles. So in a new aquarium situation, and again, it can be for a pond or an aquaculture system, ammonia's first. As the ammonia levels raise up, then your first bacteria starts dividing so they can break down the ammonia. They then convert it to nitrites. They have to reach a substantial level for a particular time before the next bacteria takes over and can break those down into nitrates. When you're talking about doing water changes in an aquarium system, I bet you 90% of the people that are doing water changes are doing it because of an emergency situation. They've reached high enough levels of ammonia or nitrites that the only way they can remove them is by changing 50% of that water. Theoretically, the only reason you should be doing a water change except in an emergency situation, is to get rid of the nitrate levels. So if you've got people coming in and saying, oh yeah, I do water changes once a week, they should be doing it to get rid of nitrates, but most likely they're doing it to get rid of the ammonias and nitrites. In the aquarium fish, and it stands hold also for the aquaculture fish, this is the order of the common problems that I associate with fish. Number one is water quality, followed by external parasites, external pathogens, and finally, systemic diseases. Water quality parameters, just to quickly cover those, involve temperature, dissolved oxygen, pHs, ammonia, nitrites, nitrates, hardness, CO2, turbidity, and salinity. Obviously, salinity is not important if you're dealing with a freshwater system. But just think, if you're in practice and somebody brings them some goldfish to you and you ask them what their water quality parameters are, they may know temperature. They're not going to know dissolved oxygen. They may know pH. Some of them may know what ammonia is. They may have even heard of ammonia. But nobody's going to be doing nitrites, nitrates, hardness, CO2, and turbidity. But these are the general parameters that we measure here for all aquaculture cases and for aquarium fish that are brought in here. Nitrates and nitrites are probably not as important in a marine system because the chloride ions outcompete the nitrites, and so therefore you have less toxicity. But you have to know temperature, pH, and dissolved oxygens. How do you measure these parameters? Very quickly. You've got commercial kits that you can buy at any pet store, maybe not as accurate as you'd like. They're colorimetric tests. You just add water, a couple drops of that, and you compare it to the colors. You can go to a more expensive kit that may have more than one parameter. Here we've got pH, hardness, ammonia, and nitrites. You can go to a spectrophotomic method, which is a lot more accurate than these commercial products. Basically, you're doing a titration system or looking at color degradation by a spectrophotometer. When you're talking about dissolved oxygen, you have, again, the same range of different diagnostic type of equipment. You could have something as cheap as an ampule system. This kind of system will run maybe $35 for maybe 40 tests. You could have what is known by the aquaculturists as a hack kit. That may run you $165, but includes probably 9 or 10 of those water quality parameters that I was suggesting should be looked at. Or if you're going to be doing dissolved oxygens on a daily basis for a lot of different situations, you may want to get a $300 to $600 DO meter. So there's a lot of variation in just testing for dissolved oxygen. So what I'd like to do after I've gotten off of that soapbox for a little bit is talk about some of the antemortem and postmortem techniques that we use for diagnosing fish diseases. Before we even do anything, you have to consider use of a tranquilizer, sedation, anesthetic of some sort. What we commonly use is what's known as MS-222. It's tricaine methanosulfonate. It's a tricaine derivative. We use that at anywhere from 50 milligrams per liter to 200 milligrams per liter. We can use it for anything from sedation to complete anesthesia or euthanasia. You can also use CO2. AVMA also allows for killing a fish, CO2, cervical separation, and blunt trauma for big fish. Throwing fish on ice is not approved. For anesthesia, basically we put in anywhere from 50 to 200 milligrams per liter. There is some species differences on the amount of anesthetic you'd want to use, but basically you put it in the water, you put the fish in the water, you let the fish acclimate to it for a while. It starts losing buoyancy, it starts to belly up, and finally it'll get to a state like this. This is not a dead fish. This is a fish that you can take out of this anesthetic solution, put into fresh water, and it will revive anywhere from 5 to 10 minutes. The fish could be like this for 10 or 15 minutes at these dosages without killing it. A lot of times people will, oh, well, it's a dead fish, take it out, put it on a table, and 10 minutes later, that fish will start flapping around on the table. So I'll get to a point later where any time that I'm going to do a necropsy on a fish that I've done anesthetic like this, I always do a cervical separation just to avoid any problems with fish that are technically not dead. Diagnostic techniques that we use, here's a good name for you, a biopsy, but the common names are skin scrapes, fin snips, and gill snips. We also can do blood fluid samples. You can do aspirates. You can do bacterial-viral isolation, parasitology, imaging techniques. Yeah, we actually radiograph fish. And then you get down into your postmortem techniques of a necropsy and doing histology. Skin scrapes, basically we just take a small glass cover slip and we run it down the side of the fish. We run it from the anterior, from the head to the tail. In other words, in the direction of the scales, not against the flow of the scales. And again, as Dr. Ferguson was saying the other day, you have to remember that the epithelium, the outer layer of this fish, is a living layer. So if you're getting any scales on a skin scrape, you've actually caused direct trauma to that fish. Direct trauma can lead to secondary bacterial infections. They can lead to osmoregulatory problems, fungal infections. So you want to be very light. All you want to do is gently just take it down the side of the fish and you're trying to gather some of that mucus. Fin snip, you can just take off one of the pectoral fins, just snip off the end. Yes, you do get a little bleeding there. There definitely is trauma there, but they generally seem to grow back without too much problem. Again, assuming that you put that fish back into a clean environment. We next lift up the operculum. And let me just reemphasize, this can be done on a fish that you're going to return alive to the client, all these techniques so far. So you need to be very careful. I'm handling all the fish with gloves. I do it because I'm allergic to the mucus on the fish, but I would recommend it anytime because it's less traumatic on the fish. The fish, you put the gloves on, wash the dust off of them, and then handle the fish this way. Next, I lift up the operculum, and at this time, if you want to take a gill culture, you can take a small little microculture, a culturette, and just put it in the opercular cavity, roll it back and forth. Now, you have to realize that when you do a culture from the skin, any skin lesion, or from the gills, you're basically sampling whatever's in the water. So you have to take that with a grain of the results of that bacterial culture with a grain of salt. Sometimes you'll come back with 20, 30, 40 different types of bacterial colonies on a plate. Sometimes you'll only come back with one or two. But again, I emphasize you need to take these with a grain of salt. Also, another thing I probably ought to state is all bacterial cultures from fish should be done at 20 degrees, not 37 degrees. 20 degrees because that's the optimum temperature for piscine bacteria. Not 37 because if you grow them at 37, the other associated bacterial fauna that is associated with fish and water outgrow all fish pathogens. So they have to be done at 20 degrees. Next, I take a small snip of the gill filaments. Now, I'll show you some slides later, but we're just talking a little tip of those red filaments that are sticking out from that cartilaginous arch that they've got there. Yes, again, they'll bleed a little bit, but if you put them back into a very clean environment, they should have no problems. I take that gill filaments, I put a drop of water on the slide. I do not use tap water. I do not use deionized, distilled water. I use the water the fish arrived in. If you put a gill filament on there and you've got a bunch of protozoan and you put it into chlorinated water, those protozoan will just die even before you get a cover slip on top of them. So always put them back in the original water. I spread out the gill filaments, put a cover slip on top of them, and put a little bit more of aquarium water or water the fish arrived in just to keep that filaments from drying out. That cover slip also places a lot of pressure if it doesn't have a full layer of water under it puts a lot of pressure on the gill filaments and also the protozoan or external parasites that you may be looking at, and they may squash and rupture just due to the pressure. Again, for culture fish, do the same thing. A cover slip, I just take it down the side of the fish. Fin snips, gill snips, and you can see up here is the cartilaginous arch, and I don't want to cut that. That's the major blood supply of the branchial cavity. So all you're talking about is taking off just little bits of tips off of here. So what do you see with these biopsy techniques? Now again, these are techniques that are used on fish that can be returned back to a client or back to an aquaculture system. You can use these techniques for general monitoring, something that generally isn't done in the aquaculture industry. First of all, this is a skin scrape. First thing about it is you've got scales on it, so this was too heavy of a scrape. But it also shows very classical protozoan parasite there. It's a holotrichs ciliate called Ichthyopteris, common cause of ick or white spot disease. Has the characteristic C-shaped nucleus, so it's very easy to identify diagnostically. It's also a very large parasite. They can be up to 1 millimeter in diameter. Here's an example of a fin snip showing the same organism. These are all individual protozoan, and you can see the cartilage of the fin. Here's a gill snip showing the whole thing is called a filament. You have the primary lamellae running down the center, you have the secondary lamellae running out the side, and you have the blood supply on both sides. Again, same organism there, diagnostic. Getting into bleeding techniques, it can be done singly. Generally, I use 2 people when I bleed fish that I don't want to bleed terminally, but tilapia are maintained very easily by just putting a little pressure on them and bleeding them from the caudal vessels. A lot of people have historically done heart punctures. I do not recommend it. It's an absolute wonderful way to get a secondary bacterial endocarditis. Also, it's very traumatic at times, and a lot of species of fish, there is not an adequate approach to the sinus venosa or the ventricle for taking blood. So what I recommend is using, sticking needles into the caudal or the tail of the fish, the peduncle of the fish, and bleeding from those vessels. Now I can't tell you, well I can tell you, I honestly do not believe you're getting a true venous or a true arterial sample when you're doing this. If anybody has ever bled a fish that is fairly transparent, you'll see that the fish develops a huge hematoma, and you're probably bleeding a hematoma rather than pure arterial or venous supply. But on trout, basically, you have 2 approaches to this blood supply, which is just ventral to the bony structure of the backbone. You can do it ventrally. Here's the lateral line of the fish, just ventral to the lateral line. You go in until you hit bone, back off a little bit, and you should be able to get a good supply of blood. Or you can do it ventrally. Same area that you're trying to get blood from, but you're just going ventrally into the fish, generally halfway between this anal fin and the tail, and I just go up to the backbone and then back it off a little bit. Why do it? Hematology and serum chemistries are just coming into their use in veterinary medicine. The big problem with it is that we do not have normal ranges, normal standards for any fish species. There are some excellent studies in trout and catfish, though they're not complete. There are some studies in striped bass and hybrid striped bass that are going to be published soon that are probably more complete than anything out there, but we have found from our research that the chemistry values and sometimes even the hematology depends on the culture system that fish is in, directly related to the type of culture system. So if you're trying to compare values from, let's say, hybrid striped bass that are in recirculation systems to those that you are wild caught, or those that are in cages, in ponds, or those that are in aquarium situations, values probably will vary extensively between those different populations. Often you can get acidic fluid, so you can do cytology on that, do direct smears on that, bacterial cultures from that type of fluid. Like any other animal, you basically just insert a syringe into that area and aspirate some fluid. Trout have very small scales, so it's generally not a problem, but when you're dealing with a fish like a striped bass that has very large scales, you have to be very careful that when you try to insert a syringe into the musculature or through the musculature, you go under scales and not try to penetrate a scale. There's no sense trying to penetrate a scale. Imaging techniques. It's been done, okay? I mean, CAT scans, MRI have all been done on fish. Clinical value, we're not sure yet, but we have to set baselines before we get any further with determining whether they're of clinical significance. Here's a device that was designed by Dr. Michael Stoskoff down at North Carolina State. It's a device that you can put the fish in water into the device, and by using these various holes, you can change plexiglass in the system to keep the fish within a very small area. You can also drop the water in that down to a couple inches so that fish goes off on its side and you can get a lateral view. The problem with this technique, even though it's wonderful for the fish because it never leaves the water, the problem with this is that when you take your measurements, you have to take the measurements of the water. So you are losing a lot of detail by having to have your X-ray beam go through water. More commonly what's used is fish are either taken out directly out of the water, put on a cassette, or what I recommend is that you use some sort of sedation first, then put them on the cassette. That way they don't flop off the table on you. But standard techniques work for these, and they show up real nice. We've done some, believe it or not, some GI series on trout, though again, when it takes 2 days for most of the barium to pass out of a trout, you have to wonder whether that's of any diagnostic value. Okay, so it's a little overkill, but you can radiograph angelfish, tropical fish of hopefully some size. Here's a zero radiograph of a catfish. The conventional radiography of fish does not show up all that well for abdominal viscera. That's why I've got a 0 up here. Liver mass, stomach, intestinal tract down here, swim bladder or gas bladder. Shows up osteology real well. Just to give you some examples where it might be diagnostically important, here are some catfish which were in a chronic toxaphene study, 6 months. You can see that there are some alterations in the skeletal system. Here is a normal tilapia up here. Nice big swim bladder here. I think I'd call that abnormal. That was on a nutritional deficient diet. So there are uses for radiology in aquaculture and pet fish. As I mentioned before, when I do a necropsy on a fish, I always like to make sure the fish is dead first. So I always do a cervical separation right here. There can be some problems associated with that. One of the major organs that you're going to be sampling for bacteriology is going to be the posterior kidney. In certain species, such as the trout, the kidney extends from this area, the cranial or head kidney, all the way here to posterior to the tail kidney or caudal kidney. Sometimes when you do a cervical separation here, you cut into that anterior kidney and blood flows freely on the external surface of that kidney to the posterior kidney, and sometimes you can get some external contamination that way. But with a little practice, you know how far you can cut into a fish to separate the spinal cord without cutting into the kidney. So after I've done a cervical separation, I concentrate on taking my gill samples first, basically, you can either lift up the operculum. In this situation, I've cut it off so I can show you what's underneath it. And basically, you've got 4 branchial arches here, each one that has a pair of filaments that running side by side. So you have 8 layers of filaments and 4 branchial arches. For histopathology, I take off the entire branchial arch. Again, if I was doing a gill snip where I wanted to return this fish back to the culture situation or the wild, I'm only going to be taking off this much. Whereas if I have a fish that I want to do a complete necropsy on, I go all the way back to the branchial arch. I cut it ventrally and then dorsally, and then you can remove the whole arch. And I dump this into fixative. Please, I'll warn you right now, let your histology technicians know that you're submitting cartilage to them. They will come looking with knives if you don't tell them you've got cartilage or bone that you're submitting to them. They don't like it unless they know it's there. But I feel you can decalcify this if you need to, if it gets thick enough. For a trout this size, half a pound to a pound trout, you generally do not have to decalcify. But again, let your histology technicians know that you're submitting cartilage or bone to them. As for fixative, I generally use 10% neutral buffered formalin. Sometimes we use Bowen, but Bowen's has the advantage that it decalcifies. Staining qualities do show up differently on histopath. The biggest problem is that you have to wash out the buoyants before you can process that tissue. So generally, I just stick with neutral buffered formalin. I feel more comfortable handing that out to aquaculture facilities rather than buoyants also. So I think it's probably a better choice. Opening up the abdominal cavity, I want to make an incision, cranial to caudal, the anus being right about here. And what I generally do is start from the anterior end of the fish. A lot of people go from the posterior end of the fish, but I feel that I like to teach people to do it the other way because there's a great tendency that if you start down at the tail of inserting those scissors right into the anus and slicing the fish up. And that's what I'm trying to avoid, is cutting into that GI system. So I always cut here through the cartilaginous pad. Heart would be located anterior up here. Here are the 2 pectoral fins. I cut generally just anterior or just between these 2 fins. Make a nice clip incision there and go caudally. I still haven't taken my bacterial culture. Realize that. Whoops. I've made the incision all the way down. I can then open up that abdominal cavity. I can open it up even farther, and you can see generally most of the organs of interest that you'll probably be looking for in necropsy. Liver, there are a lot of cecum, intestine running around here, spleen. You've got gonadal tissue up here, gonadal tissue down here. That's the swim bladder. Now I point that out because it's very important. My surface that I want to take a bacterial culture from the kidney is behind that double-walled or ventral wall, dorsal wall of the swim bladder. So the kidney is still a sterile surface. So what I try to do is eviscerate the fish even before I take histosamples of the soft tissues, because I want to get that bacterial sample first. So I've just pulled it up here. I'm cutting it off cranial to the liver. Here's the esophagus right here that I've just cut off. Stomach, cecum, liver, gonadal tissue. I'm pulling that caudally out of my field of bacterial culturing out of my way, and along with it generally comes the swim bladder. Swim bladder is still inflated here. And so I pull it all caudally, hanging out the end of the incision that I made in that fish. And that's the kidney. Most bacterial cultures should be taken from the posterior kidney, unless you have other reasons to go to other areas, like the liver or the spleen. Most of my cultures come from this area, the posterior kidney. There is still a thin layer of tissue over that kidney, but these microculturettes will penetrate that generally readily. So you insert it in the posterior kidney, twirl it around, pull it out, put it back in your culturette tube, and submit it. And again, make sure your bacteriologist, if you're at a place that is fortunate enough to have somebody else doing your bacteriology, make sure they know it's fish, so it's done at 20 degrees. Let me go back one picture. This organ right there, called the corpuscles of Stanius, it's a neuroendocrine organ, probably involved with calcium regulation. It's not a tumor. A lot of people have submitted tumors, white tumors from fish, and been surprised what it is. On trout, they are very superficial. They're embedded in the kidney, but they're very superficial, so you can see them. In a fish like the striped bass, they are embedded in the tissue, and so you don't see them grossly. Before I take any other histology, I then go and get the kidney. I take off that layer of tissue and just pull it back. No brute force involved there. I undermine it with a pair of scissors, and I take out that piece of kidney and put it in fixative. And see right here, I'm just pulling it out. And that's what it looks like after I've pulled it out and dropped it into fixative. The two tissues that I feel autolyze the fastest, but that I need the best information from, are the gill tissue and the posterior kidney. Probably ought to digress here and also indicate I personally do not do any bacterial culturing from fish that are more than 5 or 10 minutes older than dead. So all fish that I do diagnostics on have to be submitted live. The bacterial flora of the kidney will change, depending on the species of fish, within 5 minutes of death. So often there's really no reason to do bacterial culturing on a dead fish.
Question.
Yes?
When you had cut this posterior kidney for fixation, you used the scissors.
Yes.
Is it not better that you should take a sharp scalpel because of the...
No, what I do is I use sharp scissors at both ends, submit a hunk of tissue into fixative, and then I come back and trim that in the center for presentation to the histopath lab. So I'm not involved with either ends where I've used blunt dissection on it. One other organ you may want to look at is brain tissue. Again, go back to where we've done our cervical separation. Make 2 lateral cuts from the bottom ventral portion of that cervical separation all the way to the eye. Start peeling back the tissue. And as you get deeper and deeper, you can see part of the brain there, more of it there. And I haven't touched that brain at all. I would suggest for your best histopath that you then take off this cap that you've just peeled off, cut the rest of the head off, and put that whole head into fixative. You can come back later and peel out the organ and do your trimming of it. Okay. Generally what I do is I request maybe 6 fish, 3 fish that I use for bacterial cultures, 3 fish that I may submit for histopath, and somewhere in there I use 1 or 2 of those for doing my skin scrapes and fin snips and gill samples. When you've got tissue out of a fish, there are also some other techniques that you can use. You can do just squash preps. Here's a squash prep of the intestine of an angelfish. And what are these large things? Any idea? What do people feed angelfish? They're brine shrimp eggs. Often this can be a real problem with a lot of the pet fish industry because they're hatching brine shrimp eggs and they're, for some reason, don't read the directions properly and they're feeding the empty brine shrimp shells to fish. Fish can digest a minimal amount of these over a general period, but if fed in large quantities will bind up in the posterior intestine and cause death. Here's a squash prep of the intestine of an angelfish. Easy diagnosis here. We've got capillaria. More anterior to that, another squash prep, and you've got the capillaria worm. Here is a squash prep of the liver. Any ideas? Good, let's just call it a granuloma. Probably mycobacterium. But diagnostic. You can take that, you can then take that cover glass off that, excuse me, off that tissue, take that tissue and fix it for histopath. We've already talked about fixatives. I guess one thing that I would like to suggest is that when you're dealing with aquaculture type of fish, we're talking big fish generally. Yeah, you're going to be submitting particular tissues, piece of liver, piece of heart, piece of kidney, blah, blah. When you're dealing with tropical fish, don't be afraid to submit the whole fish. That's how I generally submit all tropical fish or even cultured fish that are smaller than good-sized angelfish. I trim off, I inject the abdominal cavity with formalin. I trim off the tail later, trim off dorsally, and all these tissues here can be looked at. This is a technique that, and I'll give you credit, Marilyn, that Marilyn Wolf and Suzanne Botts taught me at Aquavet 2. And it's true. You can actually see gill tissue, thymus, anterior kidney, posterior kidney, depending on the section, spleen, intestine, and it's all in situ. It's wonderful. And in an angelfish, you get posterior kidney running from here to there, then you get anterior kidney, you get gill arches here, you get eye, you get brain. It's a wonderful technique. Use it. Before I jump on to another little subject, I thought I'd give you a little more information of where you can find normal histology of fish. There are 4 texts out there right now. Channel catfish can be gotten from Auburn. Histology of the striped bass is an AFS Society publication. Microscopic Anatomy of the Salmonids is a U.S. Fish and Wildlife, so it's a government. Atlas of Trout Histology is not Idaho. What is it, Iowa? Okay. Done by Bettina Anderson, who was my wife's major professor. For additional information or keeping up with the literature, these are the 6 major journals that I recommend. Diseases of Aquatic Organisms, Fish and Shellfish Immunology, Annual Review of Fish Diseases, the old standby Journal of Fish Diseases, the new AFS Journal, it's in its 5th volume, Journal of Aquatic Animal Health, and a very good but seldom found Bulletin of the European Association of Fish Pathologists. Plus there's a lot of other aquaculture fisheries journals that have a lot of this aquatic information. Now we're going to do, is this whirlwind enough for you?
Excuse me.
Yes.
You had this whole fish fixation. How did you fix this whole fish for the whole body section?
Such as the angelfish?
Yes.
Angelfish, tropical fish, small cultured fish. What I do is inject the abdominal cavity with formalin so it bulges out a little bit. Then put the whole fish down in fixative. The opercular cavity is open to the fixative. You've already infiltrated the abdominal cavity with fixative. I let that sit for probably 2 days, then come back, trim off the non-essential areas, for, like things like guppies, things like that. I don't trim anything off because just submit the whole thing. Again, you have to talk to your histotechnologist because rather than just submitting a piece of trim tissue where they take a couple slices, get it nice, and then make their one cut for you and stain it, our histotechnologist here, who is excellent, she'll take maybe, maybe 30, 40 cuts off of it. We've gotten to the point where she gets to a place where she sees gill tissue and kidney tissue, and that's where she takes her first cut. And then she'll skip maybe 10 or 20 sections and take another cut for me. So she generally submits 2 stained slides to me to look at. And we never go over midline, so I've still got half the fish left in the block.
So there must be some serial sagittal section.
Absolutely. When we first started, we did serial sections. I mean, we were getting, a couple little bit of skin, more skin, more skin, more skin, and then we got into the abdominal cavity, finally found out where the gills were. Yeah, it takes some practice and time to know where you are in these fish. Okay, let's do some trivial questions here. What is this?
Ascites, we're talking about the swelling.
Okay, ascites, that would be one. What disease is this? Is it okay if I go until 5 after? I don't care. Okay, thank you. No answers on this?
Have you injected formalin into it?
No, I haven't been injected for formalin. Okay, well, I think the answer is great, because that could be a viral disease, could be IPN, IHN, could be a bacterial disease, could be a parasitic disease, could be almost anything. So don't look at a fish and say, oh, well, gee, that's a viral disease. Rely on your background, your education, and do the smart thing and do a workup on this fish. Etiology?
Potentially bacterial.
One answer. Other potentials? Viral? Yes. Could be parasitic. Environmental. Nutritional. Could be anything. Exophthalmia and ascites are 2 key characteristics of fish disease in general. Nothing diagnostic about them. Etiology here. Primary etiology. Still agree with fungal?
Hard to say.
Most fungal diseases of fish, except for the branchiomycosis, most people feel that the fungal diseases of saprolegnia, anophthalmomyces are secondary to a other primary cause. These fish were being bled, and so they were being handled by the caudal peduncle. They were being stressed. They were having the mucus and the epithelium probably disrupted pretty good, and they were put back in their dirty water. And so they came down with a secondary bacterial or a fungal problem. Hello? White spot disease in fish. What is it? Are you sure? This is a channel catfish fingerling that does have ichthyopterias, massive infestation, silver dollar. Is that in focus? Anyway, tropical fish often have ick, white spot disease. Here's a wild-caught bluegill with a massive infestation of ick. All these little white things are the parasite. Each one of those is an individual protozoan. It's a huge organism. How do you diagnose this? How do you make your definitive diagnosis that that is ick? You do a skin scrape, you put it on a microscope slide, and you go, gee whiz, there it is, I knew what it was before. Another case of ick. And again, a gill snip obviously we'll show you what it is. Histopath, here's the organism right here, under the epithelium. Here it is in the gill tissue, and again you're getting this idea of a C-shaped nucleus. Large, large organism. What's this? Good suggestion. It's a protozoal disease, this case. Is it ick? No, because ick is a freshwater parasite. This is its counterpart, cryptocaryon. Basically the same type of holotrick ciliate, just a different name. Guesses? Another white spot disease.
Metascary?
Could be. Could be ick. Okay, so we're going to do a little gill snip on this guy. And here's the gill filament. Here's the parasite. Bingo. Amylodinium. It's a parasitic dinoflagellate that has an attached stage on gill epithelial tissue of fish. Histopath, epithelium of the gill, quite inflammatory response here. And here's the protozoan attachment. Diagnosis, white spot disease. A little better close-up. Lymphocystis. Instead of being individual little white spots, these seem to be little white grains of sand that are coalescing. This also can be extremely large. These epithelial cells that are infected with the lymphocystis virus can grow to 10,000 times normal size. Also occurs in freshwater fish. Here's a yellow perch, a severe case of lymphocystis. Generally self-limiting. They do develop an antibody immune response to it. Often what happens if you have mortality associated with it, it's because they've bumped off some of those enlarged cells and they get a secondary bacterial infection. Here's what it looks like on histopath. Here are the scales, epithelial tissue, somewhere in here, all enlarged epithelial cells that are infected. Diagnosis. I bet you'll all leave here never calling anything white spot disease. At least please don't. Here it is on the gill tissue. Each one of these areas is a cyst full of something called Hennegaia. It's a myxosporidion. This is an entire cyst within the gill filament that is packed full of spores. This is a major pathogen of the catfish industry, but can occur in almost any species. Histopath can be quite variable. A large cyst right here, and these thousands and thousands of spores. It can be interlamellar and intralamellar. There are different pathologies associated with the various forms of this disease. That is probably the most severe case. This came from Paul Bowser at Cornell. Probably the most severe case of Hennegaia I have ever seen. This is gill, and here's your primary lamellae and your secondary lamellae. And in between all those lamellae are big cysts full of these Hennegaia spores. If you go back to that gill snip that you took, and do a real heavy squash on that and rupture one of those spores, rupture one of the cysts, you get out these bifurcate-tailed spores, and you can make your diagnosis that way. Trematodes, species, whoops, how about that? That's not right. This is Myxobolus. Now you all know what this is, right? Metasaccaridia, we get them a lot in we're seeing a lot recently in the generally non-inflammatory, non-lethal. You can see in this tropical play of a you can see them on these. This is technically not white grub, but this is yellow grub up here, which is a they insist of a is in the great blue heron. This is what's known as black spot disease. Good original names here. It is a encysted metasaccharia of a digenetic trematode that the definitive host is the kingfisher. Here are some striped bass gills. You can see all the yellow grubs that are attached to the gill arches. If you do histopath on these, they just look like a big larval form of a trematode. And that's what they look like if you rupture them out of the cyst in the skin. Here's another example where you've got yellow grub in the tail, black grub right next side of it. This is a black grub. What's the difference? It's not in the parasite, but it's in the amount of melanin that is deposited by the host around that cyst. Here's the degenerating metasaccharia. Host response here, more host response. Going back to another white disease, this is the branchiomycosis. Again, you wouldn't know